Welcome to Pharmacology Outline Channel. Today, we're diving into two fundamental concepts, pharmacokinetics and pharmacodynamics. What is the difference between pharmacokinetics and pharmacodynamics? Let's start with pharmacokinetics. Pharmacokinetics is all about what the body does to the drug. It encompasses four main processes, often remembered by the acronym ADME. 1. Absorption, how the drug enters the bloodstream. For example, when you take a pill, it travels through your digestive system and gets absorbed into your blood. 2. Distribution. Once absorbed, the drug is distributed throughout the body via the bloodstream to various tissues and organs. 3. Metabolism, the body's way of breaking down the drug, primarily in the liver, into metabolites that are often less active or inactive. 4. Excretion, how the drug or its metabolites are eliminated from the body, typically through the kidneys in urine, but also via feces, sweat, and even exhaled air. Think of pharmacokinetics as the journey of the drug through your body, from the moment you take it until it's completely out of your system. On the other hand, pharmacodynamics focuses on what the drug does to the body. It's all about the drug's mechanisms of action and its biological effects. 1. Receptor binding. Many drugs work by binding to specific receptors on cells. This interaction can activate or block normal cellular functions. Second, dose-response relationship. Pharmacodynamics examines how different doses of the drug affect the body. For example, a higher dose might produce a stronger effect, but it could also increase the risk of side effects. 3. Therapeutic effects. The desired beneficial effects of the drug. For instance, pain relief from analgesics. 4th, side effects and toxicity. Unwanted effects that can occur even at therapeutic doses, and toxic effects that arise from overdosing or prolonged use. Pharmacodynamics is about how the drug exerts its effects and influences the body's functions, including both the therapeutic and adverse effects. Thank you for watching. If you enjoyed the video, please like and subscribe for more pharmacology insights. Hit the bell to stay updated. Keep learning.